My name is Ayat Agla. I'm from the Center for Global Health at Trinity College Dublin and the Sudan Medical Specialization Board. In the coming 7 minutes, I'd like to take you through our partnership journey throughout the past couple of years. We'll be speaking about how our partnership progressed, what we're learning, and where we are experiencing challenges. So a bit of profile. The Sudan Medical Specialization Board and the Center of Global Health partnered. The Sudan Medical Specialization Board is the sole professional national mandated body that produces medical and health specialists throughout the country. They award medical doctorates, fellowships, postgraduate certificates. Up until now, they awarded over 3,500 medical doctorate degrees, and I'm one of their graduates. And in the pipeline, they have over 4,000 medical doctorates too. They form the bulk of the health system. The medical and health specialists within the board provide health services through different primary and secondary and tertiary healthcare services, and they also lecture and educate medical and health specialists at university level, lead programs within federal and state ministries of health. The Center for Global Health at TCD, we're a multidisciplinary team from psychologists to clinicians, nurses, anthropologists, and economists. Of course, we have training programs at PhD and master's level and also individual modules, and we partner. We partner with United Nations agencies, governments across 40 different countries, and we use social sciences to strengthen health systems, work in human resources for health, reproductive health, and so forth. So health workforce and health workforce challenges brought us both together. As we know, it's a global challenge. We need 18 million if we were to reach universal health coverage within the SDG era. Since this morning, we've been speaking about and heard colleagues speaking about SDG number 17, which is partnerships. Well, through our partnership between the SMSB and CGH, we target SDG 17, of course, health, and human resources for health that actually cross-cut 9 out of the 17 Sustainable Development Goals. So that's how essential it is. And Sudan's health workforce landscape is similar to the rest of the globe. We have critical shortage, imbalances, inequitable geographical maldistribution, huge outmigration of our health workers. More than 60% of our doctors are practicing abroad, issues with regulation, performance, and productivity. So we envision this partnership to enhance North to South partnership, to strengthen individual and institutional capacities at both the Sudan Medical Specialization Board and the Center for Global Health, improve quality of healthcare, enhance research collaboration, skill exchange, and also avail internship opportunities between both institutes. So how our partnership has progressed so far. Our first visit was in January of 2017. We traveled to Sudan. We conducted the situation analysis to see if we wanted to conduct this partnership and had a lot of things in common. And indeed, we agreed to forge the partnership. We conducted the needs assessment workshop to identify the goals and objectives of the partnership, met with relevant human resources for health stakeholders, signed the memorandum of understanding, and established a set of shared training and research priorities, and also developed a joint collaborative agenda. Our second visit was in December of 2017, and we fleshed out the agenda into a 2-year action plan based on priority setting. And throughout that, we identified the areas of highest priority and that were feasible at the time. We looked at conducting and restructuring the research methods course. As I mentioned earlier, the board provides medical doctorates for more than 40 different specialty councils. So if I may, it's like the royal colleges all under one umbrella. from medicine to surgery to pediatrics, obstetrics and gynecology, adding up to 40 different specialties. And in partial fulfillment of their medical doctorate, they have to submit an MD thesis. So research is essential for every specialist graduating from the board. So that was the area, and this is the area that we identified most importantly to strengthen and enhance. We looked at restructuring the research methods course and updating the thesis guidelines for the candidates. And also among the priorities identified in the first visit in the needs assessment was looking also at supervision. So we conducted supervision workshops with both the supervisors from the different specialty councils and the candidates, the residents also within the Sudan Medical Specialization Board to develop a supervision manual package, including guidelines, including meeting record templates and supervision contracts. And our upcoming visit will be next week. We'll be traveling to Sudan through a second successful grant from ESTHER Island. We're hopefully going to purchase telecommunication software to enhance and facilitate communication and joint activities. What we are learning? Well, we leverage from opportunity. As David mentioned earlier, an agreement was signed between both the HSE and the Federal Ministry of Health in November of last year. So we stand on stronger grounds now. We find every opportunity to meet, discuss, and share ideas. Although our trips are, well, once or twice a year, yet in between, we have ongoing activities, and we jointly present in conferences and share our experience with the wider global health arena, whether in the Global Health Systems Research Symposium 2016, 18 in Liverpool weeks ago, or during the 4th Global Human Resources for Health Forum. Team effort is essential. So team effort plus joint vision and true leadership are key in making things work. And this is what we've learned throughout our partnership journey. And we can achieve so much with so little financial resources. I mean, we've been going back and forth, sitting with people, conducting these assessment workshops, and working actually on priority areas that are of benefit. So ownership leads to sustainability and hopefully to success. We are experiencing challenges, as most of us in the room are. Funding is a serious issue to implement activities. And also in coming back and forth, there's high technical staff turnover, especially from our partners in Sudan, and challenges with the institutional atmosphere for research, which we'll hopefully try to overcome with more stable communication and activities. So we'd like to acknowledge Esther, Nadine, David, and the rest of our team at CGH and at SMSB. It's teamwork, and throughout it wouldn't have been possible.